how is this possible? Like 1 pound, 5 ounce little thing. They had told me that there was an excessive amount of protein in my urine. At that point, I was 25 weeks in 3 days, and they had told me that we are going to rush you by ambulance down to Iowa City because we don't know how much longer she's gonna stay in your body for. We got here, did a stress test, ultrasound, all that stuff, and I couldn't feel her move. I was very afraid. They said they could very slightly hear her heartbeat, but it wasn't as strong as what it normally should have been. So at that point, my family went home for the night because there was nothing that was going to be done. I was just gonna be on bed rest. As soon as my family left, all of these doctors came rushing in and it's like, we have to take Natalie out now. Like there's no more waiting. Your body's shutting down, her body's shutting down. We have to do something about this right now. And they called me in, I think at like 5:58 p.m. is when I officially went in, and then I had her at 6:01. So it was very, very, very quick. They immediately started a resuscitation because she wasn't breathing, she wasn't crying, there was nothing. And I was just scared to death that something had happened. And then they took her straight to the NICU, and I didn't get to see her for 24 hours. They brought me her little footprint, and I was just beside myself because I was overjoyed that not only were they able to save me, they were able to save Natalie. You could see the veins pulsing through her body. You could see her heart through her thin skin. But I just remember just like looking at her and then looking at my family and then looking at her, and I'm just like, how is this possible that she's sitting here right now in the way that she is?
It was a little nerve-wracking to say the least, but we had some great people down here that helped care and calmed her nerves down, and made it very comfortable.
One of the first things that she was diagnosed with was bilateral brain bleeds, grade 2 on the left side and a grade 3 on the right side, meaning that there was brain damage from lack of oxygen in her body. Thankfully, after about a month, everything kind of started to clear up. She also was diagnosed with lung disease. We knew that her lungs hadn't developed, so we knew that she was going to be on long-term oxygen care. Obviously was unable to eat, so when I saw her, she had a feeding tube. Natalie was in the NICU for 128 days, so just over 4 months. So by the time that Natalie was discharged from the hospital, she was 8 pounds. She essentially looked like a newborn still. But ironically enough, we didn't see improvement in her developmental milestones until COVID hit. Natalie did not leave the house for 6 months. And I think she was about 20 pounds at 5 years old. But in that 6-month period, she had gained weight. She started thriving. She started hitting her milestones. She was just growing. So Natalie is a Spitfire.
Pretty spunky and very active with sports.
Go, Nat!
I love golf, dance, and softball. It's hard because I love soccer. Where did that come from?
She is a ball of sass. She's very outgoing. She's very loving, caring, never gives up, never quits on anything. If something is, bothering her or knocking her down or having any issues with anything, she just gets right back up again and continues to keep moving and goes on.
So the Stud Family Hospital means everything to us. They've been so helpful from the very beginning when she struggled after being born, to our most recent experience.
As a parent, having somebody out there that cares just as much for your child as you do is mind-blowing.